The procedure can be explained as follows. Laparoscopic myomectomy is a minimal invasive surgical technique. It involves the use of laparoscope, a small lighted instrument with a camera inserted through a small incision in the abdomen, sometime in the belly button. This allows a surgeon to visualize the pelvic organ and precisely remove the fibroid from the uterine wall. The uterus is then repaired and left intact. Ladies and gentlemen, welcome to an in-depth exploration of laparoscopic myomectomy, a cutting edge in surgical intervention that has transformed the treatment landscape for women suffering from uterine fibroids. Firstly, let's talk about the indication for laparoscopic myomectomy. Laparoscopic myomectomy is recommended for women who wish to preserve their uterus and potentially bear children in the future, and who suffer from symptoms of fibroids. These symptoms may include heavy menstrual bleeding, pelvic pain, discomfort during intercourse, or pressure on the bladder or the rectum. It is also indicated for fibroids that are suspected to be interfering with fertility or implantation of the embryo or the baby. Pre-operation preparations. Patient undergoing laparoscopic myomectomy may need to understand or undertake several preparations. Pre-surgical evaluation to assess the size, the number, and the location of the fibroid. Blood tests, imaging by gynecological ultrasound, and sometimes hysteroscopy. Medication may be prescribed to reduce the size of the fibroid and minimize blood loss during surgery. Patients are advised to fast for a specific period before the procedure. Intraoperatively assessment is also important. During the procedure, the surgeon carefully evaluates the uterus and the surrounding organs. Ensure precisely the removal of the fibroid while preserving the uterine integrity. Techniques such as intraoperative ultrasound may be used to guide the surgeon during this process. Ladies and gentlemen, there may be complications related to laparoscopic myomectomy. This may include blood loss requiring transfusion, although nowadays with good technique, we never give patient blood. We rather put their blood into a system which clean the blood, and then we replace the patient with the same blood. Therefore, transfusion is really used as a technique of treating blood loss. Infection, in this case, antibiotics can be used to protect the patient from getting infection. Damage to the surrounding organ, that's the most important part which the surgeon need to survey and look at the situation and try to know the anatomy in order to proceed. Damage to surrounding organ is common and can be avoided. Scar tissue formation, rarely conversion to an open surgery if a proper assessment and evaluation has been done. Therefore, most of these complications can be avoided with proper assessment. Benefit over other fibroid treatment. Laparoscopic myomectomy offers several advantages. Less post-operative pain, short hospital stay, and faster recovery. Reduce scarring and lower risk of adhesion formation post-operation. Preservation of fertility and the ability to carry pregnancy to term. Therefore, laparoscopic myomectomy is really the best on an advanced method to preserve the fertility and the ability of the patient to carry the pregnancy to term. Pregnancy rate outcome studies have shown that laparoscopic myomectomy can significantly improve fertility outcome in women affected by fibroids. The pregnancy rate post myomectomy is encouraging, and many more successful women conceiving and carrying pregnancy to term. These outcomes are often more favorable compared to other fibroid treatments that might compromise uterine integrity and ability for a patient to be fertile again. Should you have any question or wish for a consultation, please reach out to us at Joburg Fertility Center. Thank you.